Welcome to the Healthy Body. Dr. Alex here. Today we're diving into one of the most misunderstood topics in men's health: penis size. For decades, movies, magazines, and casual locker room banter have pushed the idea that bigger is always better, that if you had just a little more length or girth, life would be easier, confidence would skyrocket, and intimacy would be flawless. But after decades in the field of men's health and countless consultations with patients, I can tell you, that belief is not just wrong, it can actually be harmful. What I'm about to share may challenge what you've believed for years. I'm going to walk you through 5 surprising, medically backed truths about larger penises that rarely get discussed. These truths can change how you think about your own body, protect your health, and improve your quality of life, especially if you're over 60. By the end, you might just be grateful for what you already have. So let's start with the first truth, one that might make you think twice before wishing for more size. Truth number 1. Bigger breaks easier. Most men never consider this until it's too late. A penis can be injured, and the risk is higher if it's larger. We're not talking about bones here, there's no bone inside. But there's something called the tunica albuginea, a tough, fibrous sheath that surrounds the erectile chambers. When you're fully erect, this tissue is stretched to its limit, much like a balloon filled almost to bursting. Now here's the problem: with greater length comes greater leverage. Imagine bending a long tree branch versus a short one. The longer one requires less force to snap. In the same way, a longer penis is more vulnerable to a sudden, damaging bend during sex. One wrong angle, a slip, or certain high-risk positions, such as when your partner is on top or during rear entry, can cause what's called a penile fracture. The signs are unmistakable: an audible pop, immediate loss of erection, intense pain, swelling, and bruising. And here's something critical for men over 60. As we age, tissues lose elasticity, blood flow is reduced, and healing takes longer. That means recovery after such an injury may not restore full function. I once treated a gentleman in his late 60s who had been proud of his size for most of his life. A sudden accident during intimacy required emergency surgery. Although we repaired the damage, his erections were never the same again. His words to me later were, "I wish someone had told me about the risks earlier." This is why knowing your body's limits, and adjusting positions, pace, and control, is so important, no matter your age. Truth number 2. The surgery struggle. This one surprises almost every patient I talk to. Many urological surgical instruments, especially those used for procedures through the urethra, are designed for the average male anatomy. They're built to reach the prostate or bladder efficiently in most men. But if you have an unusually long penis, those same instruments can be harder to maneuver, requiring awkward angles and greater reach. Why does that matter? In surgery, precision is everything. Longer distances mean more difficulty controlling instruments, which can increase the risk of accidental trauma. As men age, the likelihood of needing urological surgery rises, especially for enlarged prostate issues. Procedures that should be straightforward in an average-sized anatomy can become more complex in larger ones. I recall a patient in his 70s who needed a routine prostate procedure. Because of his anatomy, the operation took much longer than expected, increasing his risk of bleeding and infection. He recovered, but with more discomfort and a longer healing time. This isn't to say large size always complicates surgery, but it can. And it's better to be aware of that possibility now, rather than learn it on the operating table. Truth number 3. Bathroom blues. Here's a truth that might sound trivial, until you've experienced it. Public toilet design isn't exactly tailored for larger anatomy. In many American restrooms, water levels in the toilet bowl are quite high. That means if you sit, there's a real risk of dipping into cold, unsanitary water. In some European designs, the water sits lower, but the front rim of the bowl rises higher, which can mean unpleasant contact with cold porcelain. For younger men, this might be an occasional annoyance. But for men over 60, who may urinate more often due to prostate changes, medications, or bladder issues, it can become a regular problem. Many older men also find sitting to urinate safer as balance and joint flexibility change with age. And when you're making multiple bathroom trips each day, these design issues suddenly matter a lot more. One patient in his mid-60s planned road trips around which rest stops had toilets that wouldn't cause the problem. His wife thought it was quirky. He saw it as avoiding embarrassment and discomfort. It's a small but real example of how more isn't always better in daily life. Truth number 4. Painful mismatches in the bedroom. This one touches on something deeply personal. Intimacy. Many men believe that a larger penis will always lead to more satisfaction for their partner. But as women age, their bodies change. After menopause, the vaginal walls may become thinner, less elastic, and more sensitive. Natural lubrication can decrease, and pelvic muscles may weaken. For a woman in her 60s or 70s, penetration that was once comfortable may now feel tight or even painful, especially with a partner who is significantly above average in size. I worked with a couple in their late 60s who deeply loved each other, but intimacy had become painful for her despite trying lubricants, longer foreplay, and new positions. They eventually adapted through open communication and shifting their sexual routine, but it took effort and a willingness to completely rethink intimacy. Large size can limit comfortable positions and require more preparation to avoid discomfort. Many couples with average sizes remain sexually active into their 70s and beyond precisely because they don't face these physical limitations. It's a reminder that pleasure depends far more on communication, gentleness, and emotional connection than sheer size. Truth number 5. The social spotlight you can't escape. Finally, let's talk about something you can't entirely control: how the world reacts to your body. When size is noticeably above average, it's difficult to keep private. Locker rooms, medical exams, and public showers can lead to people noticing, and sometimes talking. At first, the attention might feel flattering, but over time, it can become exhausting. I've had patients tell me they dreaded the constant jokes, sideways comments, or even strangers trying to take discreet photos. One man in his 70s stopped going to his community pool after a candid photo of him in swim trunks circulated online, sparking gossip. The attention wasn't something he wanted, but it followed him for months. There's also the assumption problem. Some people may project ideas about you, see you as a curiosity rather than a person, or even misinterpret your appearance and clothing. For a man who values his privacy and reputation, these situations can be stressful and damaging. It's a side of being big that many men never consider, but it's real. Conclusion: rethinking the fantasy. After decades of listening to men share their insecurities and experiences, I can tell you this: penis size matters far less than you've been led to believe. We've covered 5 truths. A larger size breaks easier. It can complicate surgery. It brings unexpected bathroom challenges. It can cause painful mismatches in intimacy. And it can put you under an unwanted social spotlight. Individually, each is worth considering. Together, they paint a very different picture from the bigger is always better myth. Many men with average or smaller sizes enjoy full, satisfying lives well into their later years, without these complications. Confidence comes from how you carry yourself, how you care for your health, and how you connect with others. If you want to invest in something that truly improves your sexual health and overall well-being, focus on what you can control: staying active, eating well, maintaining good circulation, keeping your hormones balanced, and communicating openly with your partner. Your worth is not defined by a number on a measuring tape. It's defined by the quality of your health, relationships, and the way you choose to live each day. So, the next time you catch yourself wishing for more, remember, many men who have more would gladly trade for fewer complications. Contentment comes not from chasing what you don't have, but from appreciating what you already do.